So we've already looked at what blood pressure is and how it changes with submaximal exercise, with maximal exercise, and also with isometric work. And we're now going to look at how blood pressure, or the effects that high blood pressure, sustained high blood pressure, has on your cardiovascular system, and maybe what we can do about it. So let's just initially establish that blood pressure is going to increase pretty much whatever. With age, your values for blood pressure will increase. That's physiological fact. But what we need to do is just make sure that that increases moderately and sort of in line with you rather than disproportionately. We don't want systolic to be exceptionally high, and we don't want diastolic to be exceptionally high also. So the fact is, blood pressure our values will increase with age, whatever. But does exercise have an effect on blood pressure? Can exercise or certain kinds of exercise positively change blood pressure, maybe reduce blood pressure? Well, there's been some indirect connection in that exercising can positively affect the chances, or the reduction in chances, of you being overweight or obese. It can reduce the chances of you suffering with coronary heart disease and with stress, and those factors can therefore reduce the chances of you having hypertension or high blood pressure. But there's very much mixed evidence. There's also a suggestion that if you suffer from moderate depression or moderately high blood pressure, that aerobic exercise can reduce your blood pressure slightly. But whichever way you look at it, if you exercise regularly, if you have a balanced, active, healthy lifestyle, the chances are your blood pressure values might be a little bit lower. They certainly won't be excessively high, which is a good thing. So what is this hypertension that I've mentioned? Well, we know that normal blood pressure values might be anywhere around 120/80 millimeters of mercury. And this is the sort of normal blood pressure that you would average out day to day. Obviously, we know that if you exercise, it's going to go up, but it will go down back to this level again. If you consistently have slightly higher blood pressure, so maybe between 120 and 140 over over 80 to 90, then you might start being a little bit concerned that maybe something is astray, because this is a symptom that maybe you're heading towards true hypertension, which is when your blood pressure values are 140/90 or above. Now, if you are consistently at this level, you absolutely need to go to the doctor, because then it's very likely that you might have hypertension or an associated condition to do with your cardiovascular system that you need to address medically, with medication. So hypertension is prolonged or consistent high blood pressure, which is at least 140/90. Real hypertension is even higher. So this is hypertension. This is serious. This is go to your doctor. If it's higher, that's considered real hypertension. And basically, this needs treatment. And the trouble with hypertension is that we don't always have glaring symptoms. It's not like high blood pressure is necessarily visible to the eye. Or perhaps you might not feel it. You might have some symptoms, but often it goes a little bit missed, and that's why sometimes it's called the silent killer. Blood pressure, basically, hypertension or constant high blood pressure, will interfere with you controlling your blood pressure. So something is astray, where you might need some medication to help you monitor or maintain lower blood pressure. So hypertension can actually, and high blood pressure, constant high blood pressure, can actually cause a lot of other cardiovascular issues. This constant strain on the vessel walls can lead to a form of coronary heart disease called atherosclerosis, where deposits build up, which in turn reduce the size of the lumen that the blood can flow through, and that again increases blood pressure. So this vicious cycle of blockage, difficulty for the blood to circulate, high blood pressure, strain on the heart, and actually, unfortunately, these lead to heart attacks, strokes, and sometimes death. So the effects of hypertension could be stroke, heart attack, heart failure, kidney failure, blindness, some very, very serious issues that we really must take care to avoid. So I'd just like to show you a short video explaining again some of the causes and effects of high blood pressure.
High blood pressure, when left untreated, can damage the blood vessels in your body. It hardens the arteries as cholesterol and calcium builds up. Over time, the arteries narrow, restricting blood flow and damaging critical organs like the heart, brain, eyes, and kidneys. The first sign of high blood pressure affecting the heart is the thickening of the heart muscle. It now struggles to pump blood into the circulatory system through narrowing arteries. Left untreated, the condition worsens, and all this time you do not feel any symptoms. Over time, high blood pressure further narrows the arteries, cutting off blood to the heart. When your arteries become critically narrow, or if a piece of the blockage breaks off, it may result in a heart attack. A heart attack can cause permanent damage to the heart muscle by affecting its ability to pump blood, resulting in heart failure. High blood pressure is a leading cause of kidney failure. Damaged blood vessels in your kidney affect its ability to filter and clean blood. Left untreated, the kidney will eventually fail and dialysis or a kidney transplant will be needed. In your eyes, high blood pressure can affect the tiny arteries of the retina. Bleeding and blockage can result in blurred or lost vision. When arteries harden in the brain, you can suffer a stroke that damages brain tissue. Some arteries may rupture, causing bleeding or hemorrhage. This can result in slurred speech, paralysis, and loss of consciousness. Do you know if you have high blood pressure? Find out how you can prevent or control it.
So what are the causes of hypertension? We obviously have established it's particularly bad for you, and we need to understand that there are actually some uncontrollable factors, things that we can't actually do anything about, but there are plenty of controllable factors, and if we can sort these out, then maybe we reduce the chances of us suffering from hypertension. Uncontrollable factors might be things like hereditary, so if there's a history of hypertension or coronary heart disease in your family, you may have a slightly greater chance of suffering yourself. We've already said that as you age, your blood pressure goes up, you can't change that. And there are sometimes some race-related factors that influence your risk of hypertension. But there are all of these factors which we can have some control over. So managing your weight and avoiding becoming overweight or obese, your activity levels, ensuring that you do regular aerobic exercise, reducing your stress or managing your stress levels in life, managing or moderating alcohol intake. Smoking would be also another factor there, and reducing or moderating your salt intake. So if we can take control of all of these factors, then we again can do our best to reduce the chances of us suffering from hypertension. So to avoid hypertension, regular aerobic exercise, don't smoke, moderate alcohol, manage your stress, eat healthily, balanced diet, and manage your weight.